Well, bladder cancer has been a very difficult area for many years. Basically, since the approval of gemcitabine over 10 to 15 years ago, we haven't really had anything approved for bladder cancer during this time. And patients with bladder cancer, metastatic bladder cancer, progress very rapidly and often suffer from their disease. So we heard a presentation today from Dr. Malowski about some very interesting new targets, both molecular targets such as FGFR, fibroblast growth factor, where there's new drugs that actually seem to have real activity in this disease. But also, probably the most exciting thing is the advent of PD-1 and PD-L1 inhibitors, because it turns out bladder cancer is very driven by a lot of mutational changes that make it a really good immunogenic cancer. We actually kind of know this because we've used drugs like BCG for many years in this disease, but PD-L1 and PD-1 antibodies have now been shown in clinical trials, including some shown at ASCO and reviewed at the Chemotherapy Foundation, to have very significant activity in up to a third of patients or more. So those studies are now going to go to phase 3 trials, and I think it's the first major breakthrough in bladder cancer in a long time.